we are making a record of how the pandemic is affecting people, especially people in healthcare, especially rural, and especially in Colorado, and as far as the KX concerned, especially in Northeast Colorado. So we are, don't feel subconscious, but we were talking for posterity. And who knows, maybe somebody will be looking at this and listening in years and years, and I hope so. So let's start out, just say a little bit about who you are, what you do, where you live, that kind of stuff.
So my name is Lori Jarrell, and I am a registered nurse. I've been a nurse for next year, it'll be 40 years. And I have worked in a variety of healthcare settings. I love education. I love to educate and help people in that way. So, and you said, oh, and I live in Brush, Colorado. What else did you say?
So what have you been doing professionally?
Well, I stepped out of the position that I'm going to talk about. I kind of did that for a little bit of time. So right now I'm taking a hiatus from work. So, yeah.
But you've done a wide variety of things in education, in research. I know that's.
Yeah, I have. I've done a whole breadth of lots of education with the University of Colorado, High Plains Research Network, with the nursing school through the university, through National Jewish. There was one on asthma. I have worked through the local college here at MC Morgan Community College. I worked at Ebenezer Lutheran Care Center, a care community for seniors here, as a staff development coordinator. So I've just done a lot of done a lot of hospice work when I worked more clinically. And I've done just a lot of things. Yep.
As far as I'm concerned, one of the great pleasures of rural care, of rural practice, is just that you get to do so many different things. And for a generalist of mind, that's a great benefit.
Yeah, so. I love that I'm a nurse and I can do such a myriad of things, as I live in a very small town in eastern Colorado. I actually love that.
Yeah. So what's this latest thing you've been doing during the pandemic, or that you just finished?
So I wondered in the midst, when this was first happening, and I thought to myself, I wasn't working clinically at that time, and I thought, I wonder how I can help. I wonder how I can fit in, especially locally, to help. Because I know that sometimes rural areas, and many areas actually, struggle with a shortage of healthcare professionals. And so I thought, in the midst of this, how can I help? And then it was only just a few days later that I heard Governor Polis on the radio. And it was his first time that he publicly said, if you are a nurse or a physician and are not clinically working at this time, or if you're recently retired, consider reaching out to one of your former employers. And so I thought to myself, well, I didn't think at all. Immediately, Ebenezer Lutheran Care Center came to mind. And like I said, they're a care community that has anywhere from independent living to full care for people. And so it really has a variety of, it's a big campus here in Northeast Colorado to be able to help seniors. And so I immediately thought of them. And so I said to myself, sitting in my car, listening to the radio, I said, today I'm going to call Ebenezer. And so that afternoon, then I got home and I called them. And I called the director of nursing, and she was so surprised to hear from me. And I said, hey, I just heard this on the radio and I want to call because if you need help, I would like to step in and help. And she was very touched by that. Just that someone would call in the midst of this and say that they would like to be a part of the solution and the help. So she said, you know what, come in and start the um, new employee, all the signups and all the things that you need to do, new hire paperwork, so that when we need you, then we can just call you. And I said, okay, great. So I went in and signed up and did all this stuff. Um, and then about less than 2 weeks later, or around 2 weeks later, on Good Friday, I got a call from her. And as soon as I saw on my phone it was Ebenezer, I knew that, something was happening. And so she just said to me, Lori, you knew this call was coming. And I said, I did. That's why I signed up. I did. And so she said, okay, well, we need help. And so that's kind of what started this whole process, is what happened.
And this was how long ago?
It was in March, mid-March, around Easter. So mid to late March. Yep.
Had you worked at Ebenezer before?
I did. I worked for them it was about 7 years ago. And I had worked for 3 years for them as a staff development coordinator. And I'd never worked on the floor before as a nurse. I only really, when I was there for the 3 years, I just really worked in the position that I was hired for. And so, but that's what I did. So I was familiar with staff, a number of staff, and staff are familiar with me. So that was really helpful. But yeah, that's what I did.
Okay. And so this time, what position did they hire you into?
So when the director of nursing contacted me, she said, we need help, additional help with infection control and help with training and teaching and monitoring and surveillance of staff. And their patients there are called neighbors. So they call themselves neighbors. So the neighbors and the staff and anyone else that may need that education. So that's what I was hired for.
And how was that? What was that like?
Well, I will say this. I was hired as that, but it became more. So as initially, for me, I will say this, what it was like. When I heard that Ebenezer needed help, one of the first things that I did after I got off the phone with the director of nursing is I actually called my kids and I said, hey, I want to let you know that I did this. My husband and I were both knew that I had offered, and so in case they called, we had talked about that. It was definitely a thoughtful process. I didn't go into it just haphazardly. I really wanted to think, am I able to help in this situation? And am I willing to go into a situation where there could be a lot of aspects that are happening, and possibly, I'm over 60, and possibly there even could be a risk for me. And so how do I feel about that? So just to let you know, to backtrack, I really had to think through before I reached out to them. My husband and I did that together. And then when they said they needed help, I reached out to my adult children and I let them know that I was going to be doing this. And my oldest, my son, said, okay, Mom, that's great, And my daughter, when I told her, she struggled with it. She wanted to make sure that I was going to be okay and that I would be taken care of and all of that. So this was a very different, I will say this, even entering into this position, it was unlike any other position of employment that I've ever entered into. Because it had a risk associated to it that I had to make a choice of whether or not I was willing to step into. So actually, that is very different than any other position that I've done. So, and somehow I felt really it wasn't just that I even wanted to help. I actually felt very called just within me to go out and help in a situation. So there you go. So working at Ebenezer, it was very different to walk into a very different situation, a situation that was charged, that had a lot of different aspects to it than any other employment situation that I've walked into. So what
And
I noticed,
probably very different from what Ebenezer was like back when you worked there before.
it was, people were very, well, first of all, what I found really interesting is when people saw me, people were actually relieved and really grateful that I was there. They were really, the thing that strikes me, Mark, is people, so many people were really touched by the fact that I had a choice to enter into this, and yet someone from the community chose to move toward this situation. I mean, one of the staff members looked at me and she said, I would have run from this situation. I would not. And it wasn't because of the situation at Ebenezer. It was just the fact of kind of this whole pandemic and what was happening in our country at that moment. And the fear, that's the thing that really, one of the things that really has struck me about this whole pandemic is how much fear there's been for people about it. And I'm not talking about Ebenezer specifically, I'm just talking about globally. So even entering into a position knowing that there's quite a bit of fear out there was really different. And yet somehow it was really interesting for me. Somehow I wasn't afraid. Somehow I didn't feel that sense of fear. I didn't feel like even if I would get the virus, that something bad was going to happen to me. So, so entering, your question was, how was it at Ebenezer? It was different because it was people were functioning at, they weren't functioning at a higher level. It's more like people were in a different place because of the situation and where the facility was in that moment. So, and that was unlike anything, like I said, that I'd entered into or that they've ever been at as well. And so it was different to go in, but I found that people were very receptive and open. People were relieved and so grateful to have another pair of hands, to have another pair of eyes, to have someone else contribute to this cause and to help in the midst. Was really quite remarkable for people. So I found it was actually pretty easy for me just to get back in there and help and do what I could in the moment.
And you said that your job rapidly expanded to more than just infection control and training around that, right? What else were you doing?
Well, so yes, there was a fair amount of teaching and training for a bit, but then as you well know, in the midst of this virus, not only in the healthcare field, what can happen is that not only do the patients or the neighbors possibly might have the illness, but then the staff can as well. And so then when you're in the midst of, a lot of times in rural areas, there already is a need for healthcare professionals. And so they needed nurses even before this virus came to the facility or came or whatever. But so there was already a need there. So then when you add on any staff that might not be feeling well and or be showing symptoms and then needing to not work because maybe we're not sure if they have the virus or not, then that adds another whole level to this. So one of the first things that I did, I want to say one of the first weekends, no, yeah, it was the first weekend that I worked. The first week that I worked as a CNA, a certified nursing assistant on the floor, because someone said something and there was a need, and I said, I'll do anything that's needed. So I worked on the floor and helped with the neighbors, specifically with direct care and doing what I could. I will say this, that was a very different role for me, and I didn't probably do half of what the other CNAs did. And boy, did my body feel that the next the next few days. So, um, but I was just grateful to be able to plug in and help somewhere. So that's one of the first things that I did. And then after a while, it evolved to being one of the floor nurses. And I had not done that, honestly, in I think it's been at least 35 years since I have been a floor nurse in Washington, D.C. back in the day. And so that was very different. And I had some helpers that helped me in the midst of that. But I did do that for probably 4, maybe 5 shifts as needed, just willing to kind of jump in and help. So yeah, that's what I did.
And how was it?
Well, what I realized, Mark, is that my teaching and training job, in my education position and research position that I've had for years, working on the floor is a totally different thing. And I felt, the truth is, I felt really overwhelmed at times.
Mm-hmm.
I felt really stressed because I was trying to learn the process and learn all the neighbors and do triple checks and plus trying to make sure that I was doing everything correctly. And it was really interesting because yet I found that for the most part, the neighbors and the staff just gave so much grace because we were all just trying to help each other in the midst. And so that was wonderful. And the last time that I was a floor nurse, I had a few moments when I was doing everything kind of at that time. I think it was the 4th or 5th time I was on the floor. And I realized in that moment, I thought, oh, this could be fun. This could actually be fun once I get beyond feeling kind of overwhelmed and stressed. But it's very different too, because not only is it just learning different things and being a floor nurse from an educator, but it was also that some of the neighbors were sicker. You know, they were sick and they needed help. And so being able to be available and help, and also especially the big thing was the PPE, putting on and taking off personal protective equipment in and out of a number of rooms is very time consuming. I just wanted to have my own little fan in there so I could, my own little personal fan to help me with the heat. And it was quite cumbersome and took a long time just to do that. So to begin under those circumstances wasn't ideal, and yet it worked. It really did work. And I was very happy to help in the midst. So that's what it was really like.
Did you feel like the PPE was a barrier between you and neighbors, or between you and other staff? I mean, aside from, of course, the physical barrier of infection, but did it affect the relationship?
I think so. As a matter of fact, one of the staff members had a great idea at Ebenezer, and because the neighbors knew her, and she said, "What I'm finding is when I go in, people don't always know who I am." And so what they did, I thought this was so creative.
Mm-hmm.
So what they did is they actually did a selfie picture, and so a picture of a staff person, and then they had people kind of wear a button or something so that when a staff member went into a room, the person could look at the picture on them and realize who it was.
Mm-hmm.
And so I think between that and hearing the voice, but yeah, I mean, I find it intimidating. I find that putting on all of the things, a head covering, a face shield, the mask, I mean, all you could see was these little eyes. And I find that can, and of course the gown and everything, and even footies, a lot of times foot protection, can be really intimidating, for people. So,
Just describe
yeah,
it.
I think it affected. What was
It's
that?
exhausting to me,
Oh my
just putting that
gosh.
stuff online.
It was. Can you imagine that? Just going in and out, and then you're encouraging people to stay, they need to stay in their rooms. And, of course, they wanted to come out and be able to see people and do things. So there were so many different elements to this. Not only us and what we had to do differently, but also the people that lived there and what they had to do differently as well in the midst of this. So yeah, it was really different.
Can you describe any ways that you got neighbors, and especially given that a fair number of them are pretty confused and so on, ways that you got neighbors to go along with the restrictions, to go along with the new routines? Were there?
Uh, there is one. The thing that comes to mind specifically is uh, there was a neighbor who there was a number of neighbors that didn't want to wear a mask. They just didn't want to wear a mask. Of course they didn't. Who wants to wear a mask? And so I thought this is so clever, is being able to say to a neighbor, and this is really helpful for some, if you would say, look, if you put your mask on, then you and I can be twins. We can look just alike. And for some people, that really helped them to be able to say, okay, or this is not only to help ourselves, but to help other people. And some people are very other motivated. And so that helped for some people to do that. I'm trying to think of other stories. So say your question again.
The question was, what sorts of ways did you develop to get people who weren't um, immediately inclined to go along with the new restrictions or the new ways to follow?
Well, that's the biggest one that comes to mind, because by the time I came in, Ebenezer had already been in this process, so they'd already kind of done that. And one of the things as staff that was really helpful is to have up on the walls, right above an isolation card, to have this specific, very simple PPE steps up there. And that was really helpful. And then in the rooms too, so how to put it on and how to take it off, donning and doffing. And in the room, then over these 3 trash cans, it was so different, Mark, because we had 3 specific in the rooms places one was a biohazard trash, another one was a biohazard with the reusable gowns that we had, and then another one was the neighbor laundry that also needed to be biohazard at that point. So, but we had a PPE instructions right above those 3 so that people would know how to do that. I didn't do this, I thought it was so clever, but I heard that somebody came up with a little song for the staff about how the steps of how to put on PPE and take it off, just trying to bring in some humor and life in the midst of this is so helpful.
Can you do the song for us?
I don't know the song. I just heard that there was a song.
Yeah.
If I knew that song, I would give it to you. I think that would be excellent. So I don't know it, but I heard that someone had done that. So I thought, oh, that's great.
Yeah. So likewise, how did it go? I assume you never quit training staff too. How did it go with the staff? Did you find resistances, or did people pretty much do what you and the administration mandated?
I would say for the most part that people were compliant. Anytime that you have something like this, there could be one thing that I realized, this is what I realized, is that, it's kind of, I will just say this, it's easy for me to walk in as an infection control nurse and say, okay, you need to do this, this, and that. And these are the steps, and, start clean with hand washing and clean, do this whole thing. And then you work on the floor and you work as a CNA and you work with a lot of patients, a lot of neighbors, and then you work on the unit as a nurse. And it's tough. I found the reality of that at times. Here, I mean, I found the reality of that at times to be a stretch. In other words, I know the proper procedures. I know exactly what I need to be doing. And there was a part of me at times that I thought, oh man, I just want to cut this corner right now
Mhm.
because of what I had to do when I had to do it and what that looked like. I didn't, but I wanted to. Or sometimes I even found myself where um, where there was one time where I actually went into, there was a daughter who was calling, wanted to talk to her mom. And so I said that her phone wasn't working. And I said, why don't I'll just run down to that room and I'll help. And so I ran down with the room, I'm sorry, to her room. And I'm standing in the room and I'm the infection control nurse. And all of a sudden I realized, and it was the first bed, there I was. And all of a sudden I realized that I was in an isolation room and I didn't put something on. And I thought, oh my gosh, I mean, uh, and so I took care of that and did what I needed to and cleaned everything and did all this stuff. All that I'm saying is sometimes it's easy. What I realized in that is it's easy to say we have to do this or that, but we are all human. And like that was a pure human just mistake, so needing to go back and help take care of that to prevent any spread and do whatever I could with that. So those are the things of what I found. But yeah, there were times when people were tired. It was difficult to continue on in this stretch of time, so yeah.
Now I know, and this is from reading the newspaper even, that Ebenezer has been one of the hot spots, I mean, nursing homes in general, but Ebenezer in particular has been a hot spot for COVID-19 disease. Had that already started before you got there? I mean, it's hard
Well,
to know exactly when it started, but were you having cases develop?
yes. Oh yeah. Yeah. And so, it started off on one neighborhood and then they were isolated and stuff to the neighborhood. And then, yeah, then it became something different. And I was there in the midst of that something different, so yeah.
That
So
must that must have been a huge stress.
it was. There was, yeah, it was really difficult. I actually really commend all the staff there. People really pulled together. I'll never forget there was one time um, that there was some CNAs on a neighborhood and they were a little short staffed because someone had called in because they didn't feel well. So they were short staffed. And I was so touched by their level of care and by their commitment, and I did not hear them complain. And
Mm.
just what they did in some of those moments were really honestly heroic. One of the CNAs was helping one of the neighbors whose family was outside and, just waving and kind of talking to her on a cell phone and doing this kind of thing because she was not feeling well. And in the midst of everything else, then that was happening. And I stood back in amazement because I thought it is remarkable to me, the staff and what's happening in this moment. And I also was really touched. Um, I talked with one of the CNAs, um, and she talked about for her and how this affected her, um, and how she saw some things, especially some end of life things, and she was able to be a part of that process in the neighbor's life. And she was so touched by that, by being able to help people and do things. and the families were so comforted by that. And I'll never forget, because she looked at me and she said, um, now I know why I'm here at Ebenezer. And she's been there for a number of years.
Mhm.
And in and through this time and what she experienced, she said, I looked at my husband and I said, now I know I am called here, and this is what I need to do. And it was in and through this experience that she really received that knowledge in a way that actually changed her life. And so, but yes, there are several. I still remember, and I think I always will remember certain times working there where I saw people that were stressed and just so stretched and doing whatever they could to help in this situation.
Mhm.
And just so many people coming together to help each other. I was so touched by that, and so touched by all the people. It didn't matter what role you were in. It just, some of these things that we kind of can build up through time of, that might not be my job or whatever. So much of that just went away in those moments. And this huge amount of just, we're in this together and we're going to do whatever we can to give the absolute best care possible. It was remarkable. I just will never forget some of the staff and seeing them and seeing what they walked through and went through. It really, I am changed because of what I've seen and what I've experienced. I am different because of this experience. Really, really.
Say more about that. How are you changed? Please.
I saw something, Mark, that it went so beyond, and I know I keep doing this, but it almost went so beyond ourselves. We just were all in there to do whatever we needed to, however we needed to. And I love how roles and definitions and how can I explain that? People went beyond themselves in a way in which I actually have never, ever seen. Except for maybe if there's a fire and people all jump and they help each other. But this was day after day, week after week, time after time. I saw so many staff that could have made a different choice, that could have done something different, and yet they still showed up. Staff that had gotten sick did not feel well, and they came back to work. They had a choice even in, am I going to go back there and enter in? There was staff concerned about, would they get that virus again? And what would that be like? They were sick to begin with and they didn't want to have it again, and yet they still showed up to work. They still gave it their all and did what they could. And I just found it remarkable. I just found it remarkable. And I would love to work in in a place like that time and time again, because it really was something. I don't think that people can really over time keep that level of care and do that, because the truth is we all have jobs and there are aspects to our jobs that we have to do eventually. And in those moments, people were not doing that because they were just doing whatever they could to help those neighbors and whatever they could to help each other as a staff.
Mhm.
And I just found the bond amazing of that. I mean, I have been through things with this staff where I will never be the same. I can look at them and we can always go back there because we know what we went through,
Mhm.
and I even walked through some things with a family, and that was really difficult, and yet it was just remarkable. And I ended up praying with a family member and with a neighbor, and we just were all so touched in the midst of this. It just created like this a vacuum of glory is all that I can think of, really. It created this time capsule of humanity that was truly remarkable in a way in which I'm forever changed. And I know many of the staff members and neighbors at Ebenezer will never be the same because of this. Never. In a great way, really, in just a great way.
Well, I know you're not working right now, and it's for a good reason. You're preparing for.
Can you actually ask that again?
I
I'm
know
sorry,
you're
can
not
you ask that
working.
again?
I know you're not working right now, and it's for a good
Yeah,
reason. You're preparing for a wedding.
yeah.
Are you going to go back to work? And if you do, what do you think you're going to do?
I will say this. I was off. I just have to tell this story because it was such a touching story for me. And I would definitely consider going back to Ebenezer. And I even told them when I stepped out, the last thing that I looked at the director of nursing and I said, I'm going to call you. And she said, I hope to hear from you. And so I'd done some testing, COVID testing. A colleague actually did the testing, a nurse, and the infection control nurse at Ebenezer did some testing, and I was with her. And I helped her, and we did this testing together. And the next morning, I woke up and I had a symptom of COVID. And I thought, well, I know the procedure. You're supposed to contact your supervisor, so I did. And I said, I have this, and she said, okay, stay home and monitor. So I did that. And about a week later, all of a sudden, I thought, maybe I'll just get tested. And she said, yeah, then we'll know. So I did get the testing, and I found out on a Saturday that I was negative. And so this is when I stepped out of the position, and I texted her on Monday morning, and I said, I'm negative, but I'd like to talk to you. And this is when I'd made the decision over the weekend to go ahead and step out of the position. And I could tell too that Ebenezer was starting to turn a corner there because they're in recovery and doing very well now. And as far as, COVID cases and all the things. So I walked into her office and there was a group of people there, and she said, well, I wanted to give you something, and I saw this and immediately thought of you. And she said, so she got out this big canvas, and on it said something, there was a verse from the Bible, and it said something about, and the Lord looked around and said, who am I going to send? And I said, Lord, send me. And it was a nursing cap, and it was something like that, the verse. And there was a nurse's cap and a stethoscope. And I was so touched by that. So I've got tears in my eyes. And here's this group of people. And she said, and people wanted to be here when we gave you this. And I was very touched. And I don't even know why I'm telling this story. But anyway, but it was just such a unique time because people were so touched of having someone stepping in from the community and helping. And then I did say to them, I'm actually stepping out of the position today. They didn't know that. And the director of nursing is a wonderful woman. And she just looked at me and she said, I know. She said, I just wanted, you said you were going to be here for a short period of time. And she said, so we just wanted to give you something and let you know. And so, but if I do enter back into working at Ebenezer, I will just be so different because of this. And I know that people are there too. And it is almost like, it's like firefighters working a lot or policemen working together in these times where they really have to rely upon each other. And then they're different because of that. They have these bonds. And that's what I feel like. And I love the mission there of Ebenezer. I love their mission and who they are and what they stand for and just the whole thing. So that's great. So I don't know what I'm going to do next, but I know after the wedding, something will come because it always does, Mark. Something will come.
So two things. One, do you happen to have that canvas handy? Can you hold it up and show it to us?
Yeah. So I'll read it. It says, then I heard the voice of the Lord saying, whom shall I send and who will go for us? And I said, here am I. Isaiah 6:8, send me. I don't know. Can you see that?
I can hold it up so that I can see the picture on it too. I can see the writing. Oh, good. Nice.
Yeah.
Nice.
Yeah, I love that. I was so touched by that. I'm like, oh my gosh. And like I said, they were just so touched with someone, and I felt very called to go there. I honestly did. It was such a, it was just, and I loved it because the truth is, I didn't go out and look for a job. I just got to jump in and help people who needed help,
Mm-hmm.
and and that's my truest self as a nurse, and I loved that. So it was a huge gift, actually, to me. I learned a great deal, by being there, and by having by really them opening up to me, just allowing me to go there. I actually gained so much because of this whole experience. And I'm actually really grateful for what's happened in our country because it, so many people in a good way are different because of it. And so for that, I'm really grateful.
It's made us pause.
It has.
Another question I wanted to ask you about, how did the administration do? And you were sort of administration and a floor nurse too.
Right.
How and what did the administration do to support the staff under these extraordinary circumstances?
They really just did a number of things as far as, um, I remember, one of the first things that the director of nurses told me, is they had brought some food onto one of the neighborhoods for the staff. And all that she heard was a staff member who just yelled, Cheetos! And she was so happy because somehow there was Cheetos. And she's like, it was just funny. It was really very funny. And so, but what's great is too, they brought in a lot of fruit and a lot of, in the staff room, there was a lot of food there. And that was really helpful for people just who didn't have time sometimes to make a lunch or do things, or it was really helpful. Even at times, they had free lunches available or free food available for the staff, even through their cafeteria. They had some of that. They had uh, um, oh, they had compensation pay for people, to be able to help in the midst of the whole situation. And they also, they had then a coach, a master's practitioner coach, who's a local coach and, works with people here. And she came in and actually, has been working at the facility and has been, when people come off of shifts or on shift, she's available at different places on the campus. And so they have people who are available emotionally. And they also had someone recently from, there's a new center opening up here in Brush, and like a trauma center. I can't remember. It's not open yet, but there's someone here who does other work, to help people emotionally. And so, that's another thing of what they've done. And this person has said, hey, I want to be able to reach out to Ebenezer and help. So then that's been something that people can do. There's a lot of spiritual care. Ro is the chaplain there and does a lot of spiritual help for people. Um, what else have they done? They've done a lot of different things, it seems like. They're also, the community support has been fabulous. The Bank of Colorado gave everyone, um, uh, money to go to an area, coffee shop called Willow. And so people can get a coffee there or something, or a beverage. And I'm trying to think, there's been, oh, and there's been so many, Mark, there's been so many families who have made things. and who have made cupcakes and cookies and brought in pizza and done all of these things for staff members who, they know that it's been a difficult time. And I just have found the community has risen up. The families of people at Ebenezer have really risen up. The staff has done that with each other in so many ways to help each other. And so there's just been all these different levels of care and help in the midst. There really has been. It's really been actually wonderful to see that. Yeah.
Has any of the staff been sick? Gotten
Oh,
it?
yeah. Oh, yeah. Mm-hmm.
And sick enough to be in an ICU or died?
No.
No, good.
No.
And I assume you lost a significant number of residents with this.
Yeah, there was definitely, people who unfortunately died in and through this. Yeah, there were.
And how are you, kind of in general, how is the mourning going for the losses? Or do you feel like that's been sort of put aside until things are normalized? How are you digesting that?
Well, I think it's one of those things where in the moment, I think that people have tried to, there's been staff who have cried, and there's been things in those moments that are really difficult, and people trying to release some of those emotions. I think that there also is, like what you said, there's also people who choose to react differently in any situation. And so some people also choose to um, wait for a while and kind of, it's like the burning fire, and how everybody goes in and you deal with stuff, and then later you kind of deal with things. And that's why I think some of these um, aspects of emotionally and spiritually helping people have been really helpful for some people with that. And I know that there has been a community like Honk for Hope. There's an organization that did that. And so there have been people who've driven by Ebenezer and doing this whole honking thing. And then they had people stop there and pray on the outside of the building. There was also the local area in Morgan County, the firefighters and the police also did a drive-by at least once or twice, where just going by the different facilities in the area just to let people know that we're all in this together. They've done that. Tell me your question again, because there was something else.
It was about mourning over.
Oh, mourning. So another thing is actually Ebenezer this next week is going, and people can, there's a chapel at Ebenezer where people can go to. There also is, people have, I think some people have even attended some services if they can, because some staff, really would want to do that. They're also doing actually a collective service on June 16th. I believe it's just for the staff, but there's going to be a time where people can come to the chapel, and where the neighbors, the neighbors who died, their information will be there, and people can do things for them, or be able to talk to people or cry or do whatever. So there's that. I think there's just, and I think there might be other things in the works, but I don't know that since I'm not there now. But those are just some things that people have done to help with that.
Yeah. So we're nearing the end of the time.
Okay.
I really appreciate the time you've given us, but we can really take as long as we want to. So are there some other things you'd like to say?
I think the thing that strikes me, but I've already kind of talked about it, because I think there were moments where it felt a little bit like combat, but like I said, that with firefighters or police or whatever, where extraordinary things were happening and everybody was rising up to meet that. And so that alone was just remarkable. I think I've really pretty much touched on, I'm trying to think if there's anything else that I would say. Oh, that was another thing is, Ebenezer actually had a situation where they put in a very large order for PPE. And I don't know really what happened in the end. Initially, it was thought that FEMA stepped in and denied that request. But all that I know is, but I think there might be other things to that story right now. But all that I know is, in other words, I think maybe the manufacturer couldn't do it or something. There was something with it. But all that I know is that what was remarkable is that people started making gowns. So many people started making gowns for Ebenezer. And so we went from throwaway gowns to actually reusing them. So that had to change the whole process in the laundry. And they had to bring in more people and do things. And then it changed the process for the staff, for them to understand how to reuse a gown, what's a proper technique, and not only a reusable gown, but then how to reuse it, and how to keep it in the neighbor's room, and what to do. There were so many different things that happened with that. But people in the community, we had people all over the place that were in the community and outside our community that reached out to Ebenezer in its time of need, and making head coverings and masks and these gowns. And that was, it was remarkable. We had a bunch of gowns in a very short period of time to help when we couldn't get the PPE, because there were times that we were literally running out of things. And so, and different churches raised up and helped with things and put out a call for help for all sorts of things. And so that was just really, that was another aspect that was just remarkable. It was such a collective, I think that's really one of the things that just strikes me. It was such a collective effort, that a sustained collective effort that I just haven't seen. I just haven't seen in my profession in all these years, And it reminded me of when we first had AIDS, because I was a nurse at the time in DC, and I remember that there was, chaos. Different people didn't want to do stuff because they were afraid, not knowing what to do. But people ended up stepping up to the plate and doing things, and that's exactly just the stepping up is really what just seen time and time again. So that really is honestly one of my biggest giveaways from that time.
I did think of one question that I hadn't asked before. You were also having been in a training position. So you had to use the best information that you were training people with. Where did it come from? And given how things were changing day by day, what were your sources of information?
So that was really challenging at times, because things were changing so quickly, and it also depended upon who you heard the information from. So things were not uniform as far as how we were going to do things, and what approach, and that made it really difficult at times. And there was a time actually where Ebenezer reached out, the administrative team, and I was on the call, we reached out to the state for help to let them know about certain things about the facility and what was needed. And in the end, we were actually doing procedures correctly and in a manner that they had not heard of before. And we were doing different things at the time, cleaning things, cleaning masks, N95 masks, and doing things that were approved by the CDC and different agencies, and they didn't know that. I mean, we got off that phone and thought, well, we're actually on that cusp. We're doing things. We're really proactive and doing the things that we need to be doing in this moment. Because we were trying to. There was administration that was trying to frequently look at all the information so we could have the best information available. But that was really, actually, that was very challenging as an educator. And I'd also never experiencing that where, and that was draining for the staff too, because you would train this way and say, this is what we're doing, blah, blah, blah. And then sure enough, uh, even sometimes the next day or a few days later, it was a different procedure. We were doing things differently. And so that could be draining, kind of tiresome for the staff and kind of knowing just that whole element of change that was happening. Yes.
So it sounds like informing yourselves was a collaborative effort.
It was.
Wherever you could find the information.
Exactly. That's what we did. Yes.
See,
Yeah,
so,
and I found that so many administrative people were there on the weekends and trying to just do whatever we could to make such, to help the staff and just to do all this together. It didn't matter if people were in finance or whatever it was, people were there to help and to pull together in the time of need. So, yeah.
all right. Well, anything else?
I don't have anything else. I got nothing.
Okay. Well, you've given a lot so far, which I really appreciate. Thank you so much.
You're welcome.